Good afternoon. My name is Margaret Holloway. I'm a director of Nemidon Limited, a biotech company based in Wellington. Nemidon specialises in the research and manufacture of topical gels from seaweed polysaccharides for healthcare and cosmetic products. We've completed medical double-blind studies, agri-quality tests, and FDA approvals. One of Nemidon's gels products, Ultra Hydration Gel, has extremely good advantages for the care of lymphedema. Severe cases of lymphedema can increase the risk of skin changes, breakdowns, and infections. The important issue here is to assist drainage and maintain skin integrity. Nemidon Ultra Hydration Gel is a unique neutral gel developed from seaweed polysaccharides to maintain a moisture balance and skin integrity, leaving skin clean, thereby making it easier for clinicians to apply manual drainage or myofascial release techniques. It also has an added advantage for patients as they can immediately put on specialized clothing after application, as it leaves no residue whatsoever. How it works will be discussed more comprehensively by Dr. Ian Miller, but to sum it up, Nemidon forms an invisible barrier several nanometers above the skin, leaving a layer of air where vapor pressure is controlled by Nemidon. If skin is dry, then Nemidon provides initial water and a pressure that assists uptake. Dehydration is prevented by maintaining an appropriate vapor pressure above the skin. If the skin provides too much fluid, the vapor will be taken up by Nemidon and transferred to the atmosphere, so it acts as a regulator. For clinicians working with patients suffering with lymphedema, I believe it is best summed up by Catherine Vickers, oncology and lymphedema physiotherapist. It's easy to use on dry, flaky skin, non-sticky or greasy, easily absorbed. Skin softens and makes it easier for manual drainage and myofascial release techniques. Clothing can be applied immediately after application. Additionally, it contains no alcohol and has no residue or smell. Water and sweat is able to pass through, and as the Americans say, skin is able to breathe. All adhesive strapping can be applied immediately after application. Very, very easy compliance, and I'll explain that reason why, and it's long lasting. Medical double-blind studies on the gel were carried out by Brighton University, UK, and proved that the product was extremely effective, 170% more effective than the placebo, and crucially, the trial showed the gel is long-lasting. Now, when it's long-lasting, once the skin integrity has improved, you only need to apply it once every 2 days. So it makes compliance extremely easy. They just pop it on when they remember, or rub it in when they remember. We also additionally had agri-quality tests done to prove that it didn't cross-contaminate and for the safety side of it. Safety and residues, it does not cross-contaminate, as has no smell, no residues, it passed. Quality assurances, it passed. Freedom from apparent side effects, it passed. UK double-blind studies. Zoo trials, which we have put on as a video on this conference site, show that how effective it was with the treatment of dry skin issues on chimpanzees at the Wellington Zoo, and FDA approvals. Now we're offering anybody who wants it a sample. It does work differently to what you're used to. When you apply it, it will absorb if skin is very dry very quickly. As the skin integrity improves, it will last a bit longer before it absorbs. But skin is left clean, and we have at least one phone call a week from people asking us, we love the job, but we went through it so quickly. And the reason why they went through it so quickly is they're used to a residue, something they can keep on rubbing or feeling. This gel will work without you feeling anything. It's gone. and it still keeps working, which has the advantages explained with clothing. Now, before I pass you over to Ian, I wish to thank Lymphoedema New Zealand and Amanda Bill. Amanda has dedicated herself to educate patients about lymphatic conditions to get the best care and results. Amanda trained as a masseuse in the Dr. Vodder method of combined decongestive therapy and does a lot of work with oncology patients. In 2020, Amanda and Sarah Rule set up a charitable trust to assist with educating, awareness, and care with lymphatic conditions. I'll pass you now to Dr. Ian Miller, and he will give more depth as to why and how this works. I just see there's a question here.
What?
No, it's fine.
Right, good afternoon. I'm supposed to try and tell you how it works, which has a certain difficulty because it does suggest a little background knowledge is needed. But anyway, here we go. The gel, when you put it on, a gel is a tangle of polymers. And in this case, they're polymers of seaweed polysaccharide. When it dries, the tangle stays, but its volume decreases, obviously. So it lifts itself off the surface and forms a thin film across the top. Why is the gel feel so smooth? Well, basically because skin is rough and it sort of goes up and down like that. And when you put a thin film across the top, it's just simple smooth. It just simple physically, it just smooths the thing out. Now, why does it hydrate? Now, this is the interesting thing, because when you think it's dry, if you dried it, say, at 80 degrees centigrade, it would have over 80% water still in it. It is actually full of water, even if you can hardly see, you can't see it when it's dried, but it is there. And what happens is this is where it gets a little bit, you just have to take my word for this, but there is an equilibrium going on and water's coming in and out from both sides. Now, to get water into the skin, what it does is it maintains a good vapor pressure over the skin, and the vapor molecules are moving really fast. If you just put water on your skin, the water's all the molecules stick together and there's no real motion into the skin. But in this way, they punch their way in. The gel maintains an 80%, say, water content. If too much water went into the skin, the gel will pull water out of the air. It's an equilibrium on both sides. It maintains its concentration no matter what. And that means that it helps to put that into the skin. Why is it long lasting? Because when it dries, it sets and attaches itself to the top of those peaks in the skin that I was talking about. That's more or less just how it works at a very elementary level. Is that, if anybody has any questions or something, I'll be happy enough to try and take them.
There is one question. Any issues with over application of the gel or just wasting of product?
No, just wastes the product.
Yeah, there's no point in putting on more than the thin layer that I told you about. That's the only bit that's doing any good. If you thickened it up, you're just wasting product.
But you can't overdose.
No.
Cool. Bernie's asked, she knows that you're in Wellington. Do you have a store that they can visit?
I will pass you back to Margaret over this one as far as supply goes.
No, we don't have a store. We have online store, and we offer to do any Zoom discussions with people. but we do not have a store as such.
Great, thank you. Well, I'll carry on and talk about the Lymphinfo Trust. Thank you very much, Ian and Margaret.
I've just got one more question here. Is it okay to use on very fragile skin? It's brilliant on fragile skin because you just need to, if you want to, you can just smooth it on and it will stay there. And you don't need to keep rubbing. As you'll see if you go to the video with the use with the chimps, they just sprayed it on their feet and away it goes. You don't need to sit rubbing. It will pass water to the skin without any rubbing or effect of destroying, you know, delicate skin.
Any more questions? Just go and visit Margaret and Ian on their profile page and you can have a chat with them there.
Yes, I'll just say one more thing. Anyone wants a sample, we're more than happy to give them out. Thank you. Thank you, Amanda. Thank you for the opportunity.
Bye-bye.